Welcome to Let's Talk Endometriosis, Decoding Period Pain. I'm Dr. Shalu Khatri, and today we are shedding light on endometriosis, a condition that affects millions of women worldwide. And despite its prevalence, it often goes undiagnosed or misunderstood. And to help us navigate through this topic, we have with us Dr. Atul Ganatra, consultant obstetrician and gynecologist, Fortis Hospital, Mulund, Mumbai, Director, Ganatra Nursing Home, Director, Progeny IVF Center, and member, Medical Advisory Board, Family Planning Association of India. I welcome you, sir. Sir, so to begin with, we hear so much about endometriosis in ads and various celebrities talking about it. So could you break it down for us? What exactly is endometriosis and why should we be aware of it?
Sure. So, endometriosis is a condition in which the menstrual blood, which is supposed to come out of the uterus, gets collected behind the uterus and gets attached to various organs. So the endometrial lining, that is the inside lining of the uterus, implants on structures behind the uterus predominantly, say the ovaries, the fallopian tubes, and the intestines. And every time a woman menstruates, there is menstrual blood collection over there. And that is predominantly what endometriosis is all about. So every time a woman menstruates, blood gets collected there. And say, for example, if I cut my finger, I would apply cotton there. And when the bleeding stops, the cotton will get stuck to it. So similarly, structures will come close to that blood when that blood dries. They get stuck to it. And you get evidence of endometriosis. Either the endometriosis could be ovarian, when you get a cyst in the ovary, or you get endometriosis of the bowel, where the intestines get stuck either to the uterus or to the tube or to the ovary, which causes severe pain during periods.
Understood, sir. So, like you said, that it causes severe pain during the periods. Now, there are many reasons for painful periods, but how can someone tell if their pain is just a bad period or something more serious like endometriosis?
So just let me add one more point. There is another entity called as adenomyosis also, in which the menstrual blood gets collected within the wall of the uterus. And every time a woman menstruates, she gets blood filled in that area where the adenomyosis is. So these are two different entities. Endometriosis is behind the uterus or outside the uterus. Adenomyosis is within the wall of the uterus. The only confirmatory way is to do a laparoscopy. However, if proper history is taken, if a decent ultrasound is done, if a proper examination is done, very often we can pick up endometriosis.
So, like you said, that there could be a difference between the way a period pain is perceived. So, there could be some conditions where there is no period pain or a period pain is simply considered as a bad period. So, is it true that endometriosis can sometimes go undiagnosed for years? And if so, why does this happen?
Absolutely. Basically, very often we see patients who come for a health checkup and we diagnose an endometriotic cyst in the ovary. It is not uncommon. About 10 to 15% of patients do have symptoms. Their symptoms typically are period pain that starts a few days before periods and then gradually resolves once the period is over, which is called as congestive dysmenorrhea. Typically, there are nerves which give sensation to the uterus. So if that endometriotic cyst or that endometriotic lesion is involving those nerves, patients get severe pain. So pain can be menstrual pain, premenstrual pain. There are patients who complain to us saying that they have difficulty in passing motion and they get severe pain while they are passing motion. If there is bladder endometriosis, they may have bladder symptoms. Very rarely, patients can have bleeding from the urine also, if they have bladder wall endometriosis.
Like you talked about that there could be pain depending upon where the lining is or where the lining is abnormally present. Could you walk us through how endometriosis is diagnosed? Is it just through these symptoms or are there any specific tests as well?
There is only one definitive test, that is laparoscopy. However, non-invasive or non-surgical methods could be one, proper history taking, two, a blood report called CA-125, which sometimes is high when patients have endometriosis, particularly ovarian endometriosis. Ultrasound and MRI. I think these are the most important investigations that will give us a hint that the patient may have endometriosis.
Now, nowadays, as we see that somehow anything and everything, any disease that take place, it is deemed as a disease of lifestyle disorder. So even when we talk about endometriosis, I wanted to understand that what role do diet and lifestyle play in managing endometriosis? Can they really make a difference?
I wouldn't think so. If a patient has an endometriotic cyst, I don't think diet and lifestyle has anything to do with that endometriotic cyst. It's predominantly, it is definitely racial. In India, we see a lot of endometriosis in Kerala and certain other states, which is more common than the others. But I think late marriages is one of the reasons why we see a lot more endometriosis than we've seen before. Late marriages and late childbearing. That is the most important factor. Of course, healthy diet will be necessary for everyone, whether it's cardiac disease or diabetes or hypertension. Today, we are the jet age in which Swiggy and Zepto is everything. So a healthy diet would definitely play a role.
This is duly noted, sir. And besides that, like you said, that endometriosis is usually because of late marriage or delayed childbearing. Uh, if it is delayed or the marriage is late, just wanted to understand that because it can also remain undiagnosed, can endometriosis also lead to other health issues if it remains untreated for a long time?
Definitely, endometriosis will cause ovarian cysts. It can cause severe dense and intestinal endometriosis. It can cause infertility, difficulty in childbearing, which is one of the most important symptoms why a patient comes to us and says that we've been trying for 6 months or 1 year and we can't have children. And that is when we kind of examine them and do an ultrasound, and then we find out that the patient has endometriosis. And if there is ovarian endometriosis, it causes a reduction in the anti-Mullerian hormone or the AMH hormone, which is the fertility hormone of the body, because the ovarian cyst will destroy normal ovarian cortex, and that causes subfertility.
So, do you have any advice for women who suspect they might have endometriosis but haven't seen a doctor yet?
Of course, if you have any symptom such as pain during periods, if you have difficulty in becoming pregnant, if you have what is called as low backache or vague symptoms, it's always good to go to a doctor and find out why. And any case, I keep telling my patients that we have a car, we service it every 3 months. But we have a body which is a machine which is working 24/7. The car is parked in a garage for 12 hours in a day. But this machine is working for the 25 or 30 years, whatever your age is continuously. It needs servicing. So one needs to do a health checkup almost on a yearly basis. It's always good to pick up things when they are early than before it becomes too late.
I love the analogy, sir, that you compared it with the car because people love their cars. So yeah, we might as well start loving our own bodies as well and visit the doctor.
They even
So
visit the doctor more often for their pets.
understood. Actually, I agree, sir. They do. They do. So does endometriosis, does it ever go away on its own, or it's something that needs ongoing management?
No. I operate an endometriosis patient almost 5 times a week. We see about 2 or 3 new patients almost on a daily basis. And sometimes when I'm operating, my cancer surgeon colleagues come in and say, it is easier to treat cancer than endometriosis. In cancer, in Hindi, if we say sab kuch nikalna hai, in endometriosis, sab kuch bachana hai. We can't take away all the organs. And that's what makes endometriosis very difficult. I have operated at least on 5 patients of endometriosis more than 7 times, right from the age of 16 to 45. So endometriosis is a disease to stay. I only tell my patients that one thing is sure about endometriosis, that it will come back. If you don't treat the endometriosis, it is definitely going to come back. There are 4 ways of holding the disease. That is by getting amenorrhea. It could be because of with tablets, injections, pregnancy, breastfeeding. As long as you have the amenorrhea, the disease may arrest. Once you start menstruating again, or if you're not on medication, it's going to come back.
So, like you said, that disease is here to stay. Are there any myths about endometriosis that you hear a lot? I think we should clear some of those up over here.
Of course, the myths are more with the mother-in-laws. They will say it is because of IUCD, copati, it is because of the woman taking pills, it is because the woman is not conceiving. They don't like women taking oral contraceptive pills or getting an IUCD inserted. There are hundreds of myths like that. the mother-in-law will come and say, "Me, wo bahar bahut zyada khati hai. Is that the reason why she's getting endometriosis?" So, I mean, I can make a big list of over 100 things which people come and tell us.
Understood, sir. So adding on to one of those myths, what this is something that we have also heard among our friends that pregnancy can cure endometriosis. So I wanted to understand what's your take on this idea that pregnancy can actually cure endometriosis.
I think I already said that. It
Yes, you
may
did, sir.
stall the disease for some time because you have amenorrhea. But whatever ovarian cyst is there or endometrioma that is there, it's going to stay. It's going to flare up again once you start menstruating. So you need to be on some medication through life. It could be, like I said, amenorrhea with tablets, injections, pregnancy, breastfeeding. It is going to arrest the disease for some time. It's never going to go away.
Understood, sir. So how can you, because you say you just mentioned about a lot of myths that are there put forth by the mother-in-laws. How can friends and family support somebody who's dealing with endometriosis?
So my youngest patient with heavy bleeding or abnormal menstrual bleeding is 7 years of age. And my youngest patient I've operated for endometriosis is 14 years of age. So it's extremely difficult to explain a 7-year-old child why she's getting heavy periods and a 14-year-old child and why she has endometriosis. Though, fortunately, girls today are very well read. But we have to explain it to our patients that this is a disease which is predominant because of hyperestrogenism. It is a tendency which is going to come. It may run in families, like fibroids run in families. Breast cancer can run in families. This is a disease here to stay. And I think the most important thing we must do, especially when it comes to our young girls and adolescents, is they must not get scared. So the counseling of the whole family as a whole, I think I must make the father, the mother, the sister, and the brother, at least the women of the house and the father, sit in front of me and explain to them what the disease is all about. And we must tell them that there is nothing one can do to prevent this disease. I don't think we can prevent endometriosis. Nobody can control when that menstrual lining is going to grow outside the uterus. All we need to do is to tell them that just like you have diabetes, just like you have hypertension or hypothyroidism, you're going to be on medication. You may have to remain on medication sometimes for life, or at least in the reproductive age group.
Understood, sir. Thank you so much for your insights. With this, we reach the end of this podcast. And once again, would you like to give any closing statement, sir?
Well, like I said earlier, please have a routine health checkup. If there's anything abnormal or even otherwise, I keep telling my patients, do your health checkup on your birthday or anniversary, whichever you don't like. But at least do it once in a year so that, God forbid, there is a problem, it can be picked up very easily.
Understood, sir. Duly noted. Thank you, Dr. Atul, for your time and valuable inputs. This has definitely enhanced our understanding of the disease. And for all those who are watching this podcast, if you suspect you have endometriosis, don't wait, just go and speak to a doctor. And for more of such health insights, like, subscribe, and follow Bayer for Health on Insta, Facebook, and YouTube. Until next time, stay informed and take care.